going to go through the external anatomy of the fetal pig. And so starting at the head, we have got the external nares, which are the nostrils, but they are called the external nares. And next are the mammary papillae. So the mammary papillae is the other name for nipples. So they have got mammary papillae. Okay. Then we've got the anus, and this is it in a female. Okay. And on a male, this is the anus. And then the umbilical cord. And so you can see that the umbilical cord's been tied off with a little piece of black string. And so this is the umbilical cord in the male and in the female. Now, next on the female, what we have down here is the urogenital papilla. So it's a papilla in anatomy means a bump. So that's where we got the name for mammary papillae. They're the bumps. And so this is the urogenital papilla. And what it covers is the opening to the urinary system and the reproductive system, which is actually called the urogenital opening. But because the male has a urogenital opening, we're going to use the name urogenital papilla to identify the name of this part on the female. Now on the male, we have got, like we said, the urogenital opening. Okay, so male pigs have an internal penis that goes pretty much along here, and if you feel under the skin, you can feel where it is, and we'll dissect it out later. And this is where the penis would come out, and that only comes out for reproduction. And so that's the urogenital opening on the male. And then you'll notice on the male also this area of darkened skin. This is the scrotum. And again, we'll dissect out the testes and the penis later. Okay. Now, let's go over to this pig that's already begun to be dissected. And the first thing we find when we open the mouth is the palate. So this is a palate. Notice that it's very ridgy. They also have very sharp little teeth. And of course, these are to hold on to the mother's nipples while they're nursing. Sometimes if a mother has a lot of babies at once, they're kind of fighting over who gets to eat. And so the rough serrated palate helps in that, and the teeth also do. So again, there's the palate. Now, if we look far, far back in the throat, we can find the epiglottis. So this is the epiglottis. It covers the larynx. And the reason that it covers the larynx is so that the pig will not breathe in, basically, any of the food or water that it's eating. So what happens is when they go to swallow food and water, the epiglottis will cover over the top of the larynx, and that will route the food behind the larynx into the esophagus, where it will go through the esophagus into the stomach. Now, going into the neck, the first thing we have is that larynx that we were just talking about. So if we dissect it up into here, we'd see the epiglottis again. So again, this is the larynx, and the larynx contains the vocal folds or vocal cords, and this is where they produce sound. So sound is produced as air moves past the vocal folds on the way out of the body. The next thing that we can see is the trachea. So the trachea is always quite easy to identify because it has cartilage rings in it. And these cartilage rings help to hold it open because this is the main airway. We want it to be open at all times so that even if something is crushing onto it, it will pop right back open. And then we can see the thyroid gland. So the thyroid gland is really small. It's involved in growth and development and is centered right on top of the trachea. Now we're going to move on to the thymus, and the thymus is a gland involved in development of the immune system. So because these are fetal pigs, their immune system is busy developing, so we can see the thymus not only along the sides of the trachea, but this is also part of the thymus. It actually gets so big in a fetal pig that it grows down and covers over the top part of the heart, which is a little bit amazing. Now, the next part is the esophagus. So if I reach my probe under the trachea, I can usually pull the esophagus out, like so. And so when we have our lab practical, I'll have that esophagus pulled out onto a little stick, and the little pin will be stuck right in it. So that's the esophagus. It's a muscular tube, of course, to carry food and drinks to the stomach. And so it's very, very different than the trachea, which is held open all the time. Now, the last part that we can see here in the throat are the salivary glands. And these salivary glands, of course, secrete saliva into the mouth of the pig. Now, as we move down to the thoracic cavity, the first thing that we want to take a look at is this sac around the heart. So this sac around the heart is called the pericardium. Remember, peri means around, so it's a sac around the heart. And this is protective as well as lubricating. And then we can expose the heart, so you can pick the pericardium off the heart once you've seen it. And then on either side of the heart are the lungs. And you might be saying, why are the lungs so small? But remember, this pig was never born, so the lungs have never been inflated with air. It's been receiving its oxygen through the mother's blood from the umbilical cord. So that's why the lungs appear quite small at this age. Now, the last thing that we come to in the thoracic cavity is the diaphragm muscle. So what I'm showing here is the diaphragm muscle. And this is a physical barrier between the thoracic cavity and the abdominal cavity. And at the same time, it serves as the major muscle of inhalation or inspiration as they breathe in. So that is the diaphragm muscle. And that pretty much takes us to the end of the first dissection.